Welcome to Voices of the Community, which explores critical issues facing Northern California communities. We introduce you to the voices of community thought leaders and change makers who are working on solutions that face our fellow individual community members, neighborhoods, cities, and our region. This is George Koster, your host. This episode is part of our series exploring COVID-19's impact on nonprofits and small businesses in the San Francisco Bay Area. Back in April of 2020, when we decided to create this ongoing series on COVID-19's impact, first on nonprofits and then on small businesses in the San Francisco Bay Area, we, like you, had no idea how long the pandemic would go on and what the health and economic impact would be in our community. With vaccinations increasing, COVID-19 cases and deaths decreasing, we're now moving into the summer of 2021 with the reopening of the economy and all of the uncertainty of our ever-changing indoor and outdoor, vaccinated and unvaccinated protocols, and the politics that will drive how we all come back together as a unified or fractured community. We will continue to shine a spotlight on the nonprofits and small businesses that make up the fabric of our community, along with the founders and staff who are struggling to deal with the impact of the COVID-19 pandemic on their operations, services, and sustainability until we can all get to the other side of the pandemic. Along the way, we will also share with you all the amazing solutions that our nonprofits, small businesses, foundations, and government leaders are working on to help us all get to the other side of the pandemic and come together to rebuild our communities with more economic, social, and environmental equality.
As much as we fundraised and as much as we helped ease some of the anxieties of families accumulating back rent, and as much as we were able to reduce some of those debt loads through private philanthropy, our families are still facing a collective total of about $1 million in back rent, which is profoundly stressful. And the portion of that debt that's not evictable could follow those families as like consumer debt, long-term debt. And so it's really, really important that we look to our state legislators to both extend the moratorium, but also provide like complete payments to completely help families reduce their back rent so that that debt isn't following them around and creating long-term problems for their housing stability.
This is the Director of External Affairs and Policy of Compass Family Services, Mary Kate Bacalao. The focus of this week's show is on how the COVID-19 pandemic is impacting our unhoused and low-income children and families. We hear from a San Francisco legacy social service organization, Compass Family Services, about their work with our families to deal with the pandemic's ongoing impact on their housing, jobs, and health. Let's return to our conversation with Mary Kate Bacalao of Compass Family Services.
I'm joined remotely by the Director of External Affairs and Policy of Compass Family Services, Mary Kate Bacalao. Thanks for being here, Mary.
Yes, thank you for having me.
I love Compass Family Services and have been following you for a while, but I have a feeling a lot of the audience members don't know about Compass Family Services. So could you please provide us a little overview of what your mission is and then some of the really wonderful programs that you provide families?
Yes, thanks, George. I love Compass too. Our mission is to support homeless and at-risk families with housing stability, economic self-sufficiency, and overall well-being. And in order to do that, we have a suite of programs that provides a full complement of services to families who are experiencing homelessness and at risk of homelessness. So sort of the front door of the agency is our Central City Access Point, which takes families into the homeless response system. You know, that program sort of triages families into shelter, it refers them to housing, and it sort of operates kind of at the center of the homeless response system for families. We also operate Compass Family Resource Center, which is reemerging as a drop-in center where families can drop in after 14 months of the pandemic. We provide family shelter and 13 units of transitional housing, basically apartment-style housing at Compass Clara House. We also have Compass Children's Center, which is a nationally accredited early care full-day program for homeless and at-risk children, 0 to 5. We provide childcare case management so that parents who are looking to get to work can access subsidized childcare to help them get back into the workforce. We also provide behavioral health services. I think this makes Compass very unique among homeless service providers. We have a whole program that provides mental health support to families and clinical support and supervision to staff. And we also provide rental subsidies, one-time rental assistance, and case management around housing assistance through our Compass SF Home program. And that's a really pivotal program to get families housed and then help them retain that housing over time.
So much of what you do obviously is in person and kind of the proverbial up close and personal with people sitting across the table from each other. How has the Compass Family Team services been impacted by COVID-19? And then now here we are 14 months later trying to come back. How is Compass Family Services planning or struggling or trying to come back and reopen and provide more service?
That's a great question. The early days of the pandemic were such a whirlwind. We pivoted in a matter of 24, 36 hours, and every service that we could put online and make remote and kind of rework service delivery to accommodate families in a way that kept everyone safe, we did. So, for example, our behavioral health services went fully remote and we were providing teletherapy to families. And there were some benefits to that, right? We lost that in-person, one-on-one environment in a confidential therapy room. But what we gained was an ability for parents to be able to just call a therapist on the phone, right? Our rate of families who are able to keep appointments actually rose. We pivoted in lots of other ways as well. So families in the early days of the pandemic were experiencing tremendous insecurity around their housing, around food insecurity. People had lost significant chunks of their income. Yet people are still, 46% of our families remain unemployed because of the hit to the economy and the kind of low wage work that those families were doing. So in the early days of the pandemic, we turned our Family Resource Center into sort of an outdoor drop-in where we have families lined up 6 feet apart down the block, and we kept the line moving as fast as we could. And we were passing out diapers and wipes and groceries, pantry items, mail. Our monthly grocery spending went from about $800 a month, where families used to drop in before the pandemic, to $20,000 a month that we were supporting families with groceries, because they were making these horrible decisions. Do we pay the rent and mitigate what we accumulate in back rent, or do we buy groceries and put food on the table for the kids? And Compass was able to pivot and provide remote, safe in-person, and then our shelter and childcare programs continued to operate. So that was a tremendous challenge for the agency and for staff who were coming in every day, commuting long distances on public transportation. A lot of our staff are low income, and so they were sharing housing with older family members or young kids, and they're coming in and providing to our families exactly the same support that they're providing to their own families. So I think the agency responded, and particularly our frontline staff, in a really heroic way. And we're all really proud of our staff and our community.
And how is it coming back? So here we are, people are getting vaccinated, people are feeling more comfortable, if you will, but we're still in the same situation with housing and still in the same situation with our eviction moratorium, which is going to come off in 30 days. Here we are on June 1st. So how is Compass Family Services trying to come back?
Yeah, we are bouncing back. So our shelter, childcare programs, and our transitional housing remained operational. Everything else went online, and we're bringing it back in sort of a phased reopening. So our drop-in center is in a process of reopening. It's not fully reopened yet, and we're keeping things safe and implementing safety protocols. But of course, everything remains a moving target. And as you're saying, we have this eviction moratorium that's expiring at the end of June, the state moratorium. And we have the rental assistance programs with the money that Congress approved at the end of last year. So we've got money from the Treasury Department coming directly into the city. And we've also got money from the Treasury Department going through the state and coming back to the city. And those programs are only just starting to roll out. So the funding is not in the families' pockets yet. And it's not even really going to be in the families' pockets, right? It's going to go right to the landlords. So we're facing a situation where in less than a month, if our legislators don't act, that moratorium is going to lift and the money won't be in people's hands yet. And so it's an extremely precarious situation. And our families, we did a tremendous amount of fundraising through last year and through the holiday season. And we're so grateful to our donor community and our community of volunteers and supporters who stayed with us during the most tough months of the pandemic. But our families, as much as we fundraised and as much as we helped ease some of the anxieties of families accumulating back rent, and as much as we're able to reduce some of those debt loads through private philanthropy, our families are still facing a collective total of about $1 million in back rent, which is profoundly stressful. And the portion of that debt that's not evictable could follow those families as like consumer debt, long-term debt. And so it's really, really important that we look to our state legislators to both extend the moratorium, but also provide like complete payments to completely help families reduce their back rent so that that debt isn't following them around and creating long-term problems for their housing stability. So we're doing all of that advocacy. We're also in a moment where there's investments proposed. There's a $12 billion package that was just proposed at the state level to help deal with the homelessness crisis. And that's unprecedented and historic. And the state, and certainly the federal government too, has a huge role to play. There's been a lot of divestment in housing, and we're at a moment where I think we're realizing the public health impacts of that. And if our public agencies and public programs don't step up, we're going to be looking at a worsening crisis and something that's going to be following us for the next several years, if not longer.
So of your many years of working there, Mary, what do you feel has been Compass Family Services' biggest impact on families in San Francisco?
I think that Compass's greatest impact has been both creating community where families can come in and feel safe. And the number of clients who reach out to Compass and say how much it feels like a second home to them is really staggering. And it's that, I think, paired with the tremendous work that our staff do every day to help house families. We recently have a former client who bought her own house in the East Bay. And it's so tremendously rewarding, right? We interact with these clients and some of them stay with us for years and years and years, and they reach back out and they're homeowners. There's someone who we supported early on. She lived at our transitional housing program, our Clara House program, and she's now a director at Tenderloin Housing Clinic, where she's giving back and helping other folks with their long-term housing status. And so we've really created a sense of community at Compass, a sense that home is so much more than just a lease and a key. It's really a support. It's networks, it's community, it's giving back to your community in ways that your community gave to you. And that's really so much of what I love about working at Compass.
So if I was listening to the show and I was really interested in supporting Compass's work, what could I do to help? Obviously I can volunteer, possibly now that I might be vaccinated, I could donate, but what are some of the things that folks who are listening to the show can do to help your efforts?
Thank you so much. Community is so important to Compass, and we are so grateful for our donors and supporters who stayed with us through the extremely tough and challenging year that we had. There are lots of ways to give back. I think private philanthropy is very important in a world where folks may feel hesitant to volunteer, and it enabled us to pivot much more quickly than we could do with our public funding. So there's a complementary role that the different kinds of support play for us, and certainly donations enable us to move really quickly, and that's essential in a crisis. We also have a full complement of volunteer opportunities. So we launched a homework helpers program where volunteers can provide remote homework help to kids in our programs. We have volunteers coming on site to help us organize the in-kind goods. And that's another way folks can drop off things like hygiene items and baby items. And we collect these things and we have other volunteers come in and organize them. And then we find a streamlined way to get them out to families, either at our programs or families dropping in, making appointments to pick up those items. So there's a lot of different ways to volunteer and give back, even during the pandemic. We have safety protocols in place, sanitizer and masks and all of that. We've been able to maintain and sustain that sense of community, and we're always very grateful for people who want to get involved and support our families.
And then you have your Home 2021 campaign that I know that you are trying to wrap up, but you've raised, I think it was over $500,000 so far.
That's right. We're so incredibly grateful for that support, which is going to help us sustain core services and build our way, invest our way out of this pandemic, making sure that families have the supports that they need to not only get housed, but stay housed in the long term and support children so that they're not experiencing traumas that they will carry with them for the rest of their lives. So that support is incredibly important.
And then turning back to the eviction issue, because it is really kind of looming. And if I want to help some family not be evicted, would my donation just go to a specific fund? How can folks help on that front besides writing to their congressperson and or mayor and governor?
So I think as you highlighted, there are two pieces to that. One is the advocacy. Contact your legislators, tell them to extend the eviction moratorium, tell them to make sure that families are getting all of the assistance they need to remain housed, to make sure that families who have not yet gotten rent relief are not going to be facing eviction, right? Those are all extremely valuable things to do. And then, yes, Compass is collecting funding that we're distributing directly to families to help alleviate their rent debt, both to keep them housed and to reduce the levels of back rent that they're accumulating so that debt isn't following the family around and destroying their credit and creating long-term problems for them and their children.
And is that on your website as far as where people can go to direct their money that way?
Yes. Folks can donate on our website, and you just indicate the purpose of the donation and the donation will go right to the family for the rent.
Thank you. That was great. And it seems like the shelter-in-place hotel model that everyone thought was impossible 14 months ago, now possible, is perhaps a bridge to that stability.
I'm really hoping so. I'm hoping that it can pave the way to help leverage acquisitions, transform private hotels into housing opportunities, and also to reimagine the way that we think about shelter. A little over a year ago, we had massive outbreaks in shelters in San Francisco and in housing programs that were kind of communal programs with a shared bathroom down the hall. And I think we have a real opportunity to look at what hotels can offer in terms of providing private rooms, private bathrooms. While the city was getting their shelter-in-place program up and running, this is part of the benefit of the private philanthropy. Compass and our partners were able to come together and pretty much overnight rent 30 hotel rooms at the same site in Soma. And the families that were being left out of the city's medical vulnerability criteria were families who were living unsheltered. And Compass thought that families are just as vulnerable, whether they have underlying conditions or whether they have an unsheltered housing status and they're sleeping in a poorly ventilated car during a global respiratory pandemic. So we leveraged that site and we got those families inside. And the number of families who said to us, gosh, the sense of relief you feel when you can close a door behind you and you're not sharing space with strangers is profound. And I think that's the sense that we should uplift in our system, right? That's a way to move towards shelter that is safe and dignified for an entire family. So I'm hopeful that we can leverage the SIP program model, not just for housing opportunities, but also to reimagine shelter.
Just imagine shelter and a universal basic income together, what we can accomplish.
Yes. And we're very passionate about universal basic income, and especially for communities that have been left out of the federal stimulus payments, for communities that have higher barriers, language barriers, cultural barriers, accessing the rent relief programs. Universal basic income could be a really important source of support for immigrant and undocumented families, especially in a sanctuary city like San Francisco. So I'm right there with you. Totally agree.
Mary, tell me a little bit more about Compass Family Services hotel program that you had mentioned with regards to helping families get out of living in the open, their car or in a tent.
Yes. So this was something, a really amazing accomplishment, I think, for Compass and our partners in the early weeks of the pandemic. The city public programs take longer, public funding moves more slowly. And so the city was in the process of opening up their shelter-in-place hotels. They also had this medical vulnerability criteria that was a bit restrictive. And so Compass and our partners basically pivoted because families were coming to us and they were already living in their cars. They were unsheltered. And we knew that they weren't going to meet the medical vulnerability criteria in the case that they didn't have the underlying conditions. And at Compass, we feel people are vulnerable to COVID based on their housing status and not just underlying medical conditions, because housing is healthcare. And so we made a commitment with our partners. We got everyone in a room, and basically overnight, this hotel program popped up. We found a site in Soma with 30 rooms in single and double configurations. It was perfect for families. It even accommodated larger families with connecting rooms. And we repurposed it really quickly. We put mini fridges and microwaves, and we had meals delivered, and we raised the funding. We pooled it with our family serving partners at Almost Prenatal and Hamilton and a couple other agencies. And we were able to get unsheltered families who wouldn't have otherwise been eligible for the city program that's being federally reimbursed. We were able to get those families out of their cars and into hotel rooms. And it was a crazy, seamless, it was just one of those moments where everyone's collaborating and everyone's excited and we're doing something new and different and really changing the game for people trying to shelter in place who didn't have a place to shelter. And so it was a really special moment for working at the agency. And it was a really special moment, I think, for the families who felt like someone had their back and someone cared. And we were able to leverage community partnerships too, right? Like restaurants that were vulnerable were able to, get donor support and deliver meals to the hotel. So there was this whole sort of community that was created out of the experience that was really special and life affirming.
And then final question, Mary. So what are some of the positive things that you see coming out of this pandemic to support children and families and housing, childcare, your mental health services?
Yeah, I think some of the good things is that, going into the pandemic, our service systems weren't working as effectively as they could, right, at the system level. Compass is working within the system. We're a majority publicly funded agency, and we're also working to transform it. And so often when the status quo takes over, there's this sense of, this is how we're already doing it. And I think that the pandemic came in and really turned everything on its head and interrupted that sense. And we find ourselves at this historical moment of, do we advocate for incremental change, or do we advocate to really transform our systems and create real opportunities for people to get and maintain housing, for families to earn an income that truly supports not just the housing, but all the things that children need? And how can we make investments that really lift people experiencing homelessness out of homelessness and out of poverty? And how do we break that intergenerational cycle so that kids are seeing stability modeled and they can build their own stability later on? So I think we find ourselves in a moment where more things feel possible than used to feel possible. And we have new investments coming in that are, many of them are one time. But I think if we're able to demonstrate the degree of need that we see across the systems, we could really transform how our social sector operates. And we can move away from this sort of scarcity model of using eligibility criteria and limiting access to shelter beds and limiting access to the shelter-in-place hotels to more of a resource equity model, where we open up resources proportionate to the needs that we see. And we make sure that we're not perpetuating racial disparities that are very stark in our homeless response systems. Most families experiencing homelessness in San Francisco are families of color. And so there's real social implications. Compass and our partners are not just like standing between families living in housing or living in their cars. We're standing sort of in this moment where we're in a national reckoning over racism, and poverty kills. And so it's really important that we're carrying this sense of needing to transform our systems into the everyday of our work. And it really feels possible now in a way that it didn't before.
Thank you, Mary, for sharing Compass Family Services work today. We'll make sure that listeners have your contact information, website, and social media so they can follow Compass Family Services, get engaged, hopefully as a volunteer, or at least make a donation. And wishing you and the whole Compass Family Services all the best in coming back and also helping people stay in place.
Thank you so much, George. We really appreciate your interest in uplifting these community voices. Thanks for having me.
That's it for this episode of Voices of the Community. You've been listening to the voice of the Director of External Affairs and Policy of Compass Family Services, Mary Kate Bacalao. To find out more and support the Compass Family Services Central City Access Point, Family Resource Center, family shelters, and wraparound services, go to compass-sf.org. After listening to how Compass Family Services is helping our families stay in housing, we hope that you will get engaged in advocating for our state legislators to both extend the rent moratorium and provide more funding payments to help families to reduce their back rent as well as support other programs. Over the past 14 months of this series, we wanted to bring voices from wonderfully powerful organizations supporting our families, youth, and adults while being unhoused, as well as providing the necessary wraparound services to help stabilize them. We hope that you will take the time to listen back to these incredibly insightful interviews with Kevin from Miracle Messages in Episode 1, Denise and Chris from Lava May X in Episode 3, Megan from Simply the Basics in Episode 16, Doug from Huckleberry Youth Programs in Episode 19, Charles and Demarie from At the Crossroads in Episode 29, along with our conversation with Lizlyn of Be Magic and Sakina of 3rd Street Youth Center and Clinic in Episode 51, as well as our conversation with George and Kenneth of Glide in Episode 42, and our conversation with one of the oldest family services agency in San Francisco, Edgewood Center for Children and Families, with Justin and Greg Biggs in Episode 32. Please tune in to next week's show on June 24th at 8:30 a.m. on KSFP 102.5 FM, where our theme is housing for our artists community, and we hear from Vital Arts and Northern California Community Land Trust, who share about their work with our artist community to deal with the pandemic's ongoing impact on their housing.
We hope that you enjoyed the insights, points of view, and personal stories from the voices of changemakers and their nonprofits and small businesses featured in this series. To find out more and get engaged with the nonprofits, small businesses, and staff members featured in the series, please go to my website, georgecoster.com, and click on Voices of the Community to find links to the extended versions of these interviews and to listen to the entire series. After listening to these stories, we hope that you will consider making a donation and volunteering to provide a hand up to your fellow community members. I want to thank my associate producer, Eric Estrada, and Casey Nance at Citron Studios, along with the wonderful crew at the San Francisco Public Press and KSFP. Voices of the Community is a member of Intersection for the Arts, which allows us to offer you a tax deduction for your contributions. Please go to georgecoster.com and click on the donate link to make a donation to help us provide future shows just like this one. While you're on our website, you can enjoy our archived past shows, which feature community voices working on solutions to critical issues facing Northern California communities. And you can sign up for our newsletter to find out more about future shows, as well as shows and events from the organizations that are included in our episodes. Take us along on your next COVID walk by subscribing to Voices of the Community on Apple Podcast, Spotify, and Google Podcast, or wherever you get your podcast. You can follow us on Twitter at George Coster, and we'd love to hear from you with feedback and show ideas, so send us an email to george@georgecoster.com. I'm George Coster in San Francisco, and thank you for listening.